If you worry about heart disease, and you should, it's the #1 killer these days, I've got some information that I think will interest you. I often talk about chelation therapy, EDTA chelation. I'm a huge believer in it, but a particular form of chelation therapy that you can do at home. There have been a lot of books written over the years about chelation therapy, most of them written by medical doctors. Here's one that I think is quite interesting, Bypassing Bypass by Elmer Cranton, MD. Dr. Cranton says that EDTA controls free radical damage. Free radicals are a huge cause of disease and aging. He says it removes lead and other poisonous metals. We know that. It's definitely been proven that EDTA chelation chelates out heavy metals, toxic metals. Dr. Cranton says it enhances the integrity of cell membranes. That's a huge thing. He says it helps reestablish prostaglandin hormone balance, which in turn prevents arterial spasm, blood clots, plaque formation, and arthritis. He goes on and on about that. I'm not going to give you all the details, but he says it protects the integrity of blood platelets, and that's a huge thing. He says that it normalizes calcium metabolism by reactivation of the enzymes poisoned by lead and other heavy metals. He says that it stimulates calcium uptake in the bones, because that's where we want our calcium. We don't want the calcium to accumulate along the arterial wall or in other soft tissues where it does damage. Dr. Cranton also says EDTA encourages overall metabolic efficiency. So he recommends it to diabetics. He recommends it to people with vision problems. He recommends it to people with neuropathy. And the list of benefits of chelation therapy is too long for a video. In fact, it takes a book this thick to list them all. There are a lot of books on Amazon on EDTA chelation therapy. A lot of them talk about different benefits. There are others that talk about bypass surgery by using EDTA chelation therapy. Now, the old way of doing EDTA chelation and the way that Dr. Cranton did it was intravenous. And it's very expensive. These days it can cost you up to $9,000 or even more. And it's a matter of 25, 30 or more visits where you sit with an IV needle in your arm for a few hours, getting the EDTA in your bloodstream. There's a better way, and it's detoxamine. Now, I normally try not to promote specific products. If there's something good, usually there are multiple companies that make it, and I tell people just get it, find a company that sells it and buy it. There's only one source of detoxamine. Detoxamine is rectal delivery of EDTA chelation. It involves a rectal suppository. You apply it every other night, and it's absorbed into your bloodstream through the rectal veins. The importance of that is that the rectal veins bypass the stomach, obviously, bypass the entire gastrointestinal system, and largely bypass the liver. So it actually gets into the bloodstream. That's why oral chelation therapy doesn't work, because by the time it's gone through the digestive tract and the liver, it's pretty much gone. So detoxamine is, according to the science, as effective or maybe even more effective than intravenous EDTA chelation therapy. It's a whole lot more convenient and less expensive. Link in bio will take you to where you can read about detoxamine, learn about it, purchase it. It will cost you, instead of $6,000, $7,000, $8,000, $9,000 or more, it will cost you somewhere around $150 for 2 months, a 2-month supply. And I suggest that if you've already bought detoxamine and done it, continue doing it. EDTA chelation therapy needs to be continued. You need to continue doing it, and you'll see the greater results. Use the promo code longevity and you'll get a substantial discount. Or you can go to detoxamine.com, use that code word, you'll still get the discount.